Hi guys, hope you're well. It's Dr. Kevin Kitt here at the Smile With Kev Medical Wellbeing Centre and Academy. I wanted to take this opportunity to share some really interesting, possibly controversial ideas. As someone who is fascinated with facial development, a background in dentistry, which is a specialist in head and neck, as well as experience in orthodontics or orthotropics, and more ancestral anthropology, which is how our ancestry, how humans, Homo sapiens, have actually evolved through time. With that in mind, and that being said, I really wanted to introduce you to the idea and the concept of plasticity. We use the word plastic in the lay terms, and what that means is that rubbery stuff or that non-degradable bits of resin or bits of methacrylates or milk bottles and so on and so forth. When we say plastic in terms of the world of medicine and the characteristics of materials, we really use that as a term of being able to mold. The moldability is what we mean by the word plastics, like plastic surgery. Plastic surgery isn't just because people just shove silicone in X, Y, and Z places. The idea is the movement, the changes, and the morphology, the evolution, and the changes in shape. That's essentially what plastic means. So you can see from the clickbait, that's a segue from plasticity, plastics, into the ideas and the concepts I'll share with you today. One of the things, bear with me, one of the things that I'll share with you today is the idea of facial development. To put things into perspective, we may, in some cultures, are familiar with the concept of ear stretching, having piercings and then having different circles, different stretches to stretch the earlobe, making it wider and wider. The idea behind that is that over time, constant pressure and constant forces will change the anatomy and the physiology and the physics and the physicality of your body. That's one idea. And then in the other concept, you might have seen things on documentaries about different cultures and different tribes whereby they have golden rings in the neck and they put various rings on the neck, and the longer the neck is, the more beautiful someone is perceived. That's another concept. It tends to evolve and change the shape of the body, and the body adapts to it. That's in African cultures, some African tribes. I don't want to tie everyone on the same brush. Another concept is the geishas, the Japanese, whereby they tie their feet very, very tightly so that they have very, very small feet. These concepts are the ideas I want to share with you, that constant pressure, constant molding, or the formation of certain physical attributes can amend, can change, and can really reform and reconstruct the way that the function and the development of something occurs. Okay, so it seems a little bit esoteric, a little bit out of the ordinary, and out with the culture. The reason why I'm talking about this is that I'll introduce you to a concept that we see in aesthetics, in facial aesthetics, and in dentistry all the time. And that concept is the idea of the anterior open bite. In dentistry, I'll use a great prop here. This is a skull, and you may see some children and some adults, as they grow up, they close their teeth together, and rather than having their teeth shut and closed like that, sorry, that's not the best occlusion in the world, I'll give you a good example, not closed and occluded like that, rather than that, I'm going to go ahead and disjoint us, okay? When they close their teeth together, they could be having an open bite. And by that, what I mean is that whenever they have a cucumber sandwich, the cucumber is left unscathed because and have the teeth touching together, the anterior, the front teeth are not touching. So what is the relevance and so what? Well, before we talk about that, let's talk about why it comes about. There are a few main reasons. It's all to do with constant pressure over time during the developmental stage. So, as kids grow up, by no means am I going to teach you how to raise your kids or lecture you. One of the key aspects of this is having something in the mouth, either a thumb or a blanket, safety blanket, or a dummy. In dentistry, what we advise is that once you have teeth in your mouth, which is the age of 6 months, we should really genuinely consider actually removing the dummy. Because what happens, let me show you the skull here, when you suck your thumb, you put your thumb to the roof of the mouth here. And that constant sucking has a buccinator, which is the muscle that helps you suck, pushes in the way. So what you will find is that the arch gets pushed closer and closer together, so they have a narrow arch. So when people smile and you see what we call the corridors of the cheeks here, with these large dark triangles, it's because they've got a narrow arch. And also what we assess is when you get them to look up and show us, or any dentist or anyone, their mouth, you'll see that rather than it being broad and wide and shallow, what happens is that the thumb pushes constantly up the way, so it becomes more narrow and more of a high vault and a higher palate there. And these are all signs of sucking thumb, sucking dummy, and that actually has an effect on the facial development, because as this becomes narrow, you can see how the cheekbone becomes smaller, it becomes less developed, more collapsed, and the face looks a lot more dipped in. Yes, this is facial aesthetics, but more so than that, these are indicators of the sinuses being smaller. Above the upper jaw is essentially the nose, the sinuses, and the airway and the breathing. And you can imagine if someone has a smaller arch, more narrow arch, think about it. What will the sinuses, what will the air passages look like? Are they going to be smaller or bigger if it's more narrow? Well, let me just go ahead and fill you in on this. What happens is that the face collapses, the air sinuses get small. And what tends to happen also is that if people have nose and breathing issues, they tend to breathe from the mouth, like day to day. And sometimes when they fall asleep, they have the mouth open because they can't breathe as efficiently and effectively through the nose, the tongue falls to the back of the mouth and they tend to have more sleeping issues. Sleeping issues have been shown, and studies have shown, that if you don't sleep well, then you don't rest well. If you don't rest well, you don't recover well. On top of that, if you're snoring, the tongue just flapping around here, if it goes and then the tongue flaps over to the airway, is that you stop breathing. This is what we call sleep apnea. Sleep apnea is when you have a lowered oxygen saturation in your body and you stop breathing. What happens also is that the body doesn't like it, so what happens, obviously it doesn't like not breathing, is that it engages the fight or flight response, the adrenaline, and it thrusts the lower jaw forward because the tongue is attached to the lower jaw, so that the tongue is moved forward so that you're not choking on your tongue anymore. And that's why some people have grinding and clenching issues. I'm going to sharing these ideas simply because I see, as a dentist, quite a lot of anterior open bites, and sometimes I see adults who feel a little bit flatter here, or they're unhappy with the narrowness of the arch, or they're having breathing difficulties as well, or they feel as if they're tired after a good night's sleep. However, it's all because of the impact. There are other issues, of course, of perhaps either sucking their thumb, mouth breathing, having a dummy for older than 6 months old because their face collapses. So you have to be incredibly cautious. Being hypoxic, which is low in oxygen, actually increases the chances of high blood pressure, increases the chances of depression because you don't recover as well, increases the chances of heart issues, even skin issues, and everything. Because if you don't rest well, you age quicker. Breathing, anxiety, and so on and so forth. Everything is so intercalated. So, if you ever see anyone who sucks their thumb, or holds onto pens or pencils with their teeth, or has a dummy, obviously not adults, it's unlikely. However, sometimes you do have adults who suck their thumb. And that's another story because it's to do with either anxiety, reassurance, it's to do with habit, it's to do with all the little things that integrate and come together. It feels as if it's a somewhat tangent today. However, as someone who is in the world of psychology, aesthetics, dentistry, orthodontics, I understand how the face develops. And you've probably heard of people talking about, oh, how I've got more teeth than my jaw can accommodate. I'd like to spin it on its head and actually say that your jaw is too small for the number of teeth that you have. And it's all about ensuring that we have the appropriate facial development, and what that means is keeping your oral hygiene good as a child, because the sequence of when the teeth come out and exfoliate helps guide the adult teeth coming in on time. So if you lose any baby teeth earlier than you should, then the adult teeth come out a little bit earlier at a different rate, at a different time, at a different stage, and at a different pace. For that reason, once again, the spaces available become smaller and smaller, the teeth become more crowded, you have more braces and so on and so forth, more collapse in the face, and people even decide to get teeth taken out to create more space, whereas in fact, the facial development has been compromised. Long story short, what I'm saying to that is be cautious of sucking thumbs, be cautious of having dummies for a long time, and any people that are around you, if they have an anterior open bite and try to close their mouth and they can't, it's worthwhile to consider what can be done to ensure that the breathing, the sleeping, the recovery can be, I'm cautious to use the word fixed, resolved and restored to harmony and balance. Because here at Smile with Kev, we really care about you, every single asset and facet and aspect, every single side, every single dimension of who you are. At Smile with Kev, dentistry, aesthetics, psychology, every part of you.